You're watching WKBN 27 First News, where your news comes first in high definition.
Welcome back. Dr. Mike Sevilla is here with me today from Salem Community Hospital. You're here to talk about the symptoms and signs of a stroke, because at the hospital you said you've had several people coming in either showing the signs or they end up in the hospital. It's a very serious thing, but if caught early, you can really prevent a lot of the damage. So what are we looking out for?
It's very important because when the brain loses oxygen, you only have a few minutes for it to be restored, and people survive a stroke. There's still a lot of disability with it. So what we tell people, the signs and symptoms of stroke, they're very sudden, whether they're weakness, especially if it's on one side, or if people have difficulty with talking, or they get confused, or they have difficulty with seeing. And those are very important to recognize right away, to call 911, to get to the hospital to get treatment.
Do you think this is something that someone that's having a stroke might notice in themselves, or is it really up to who they're around to pay attention?
Well, I think the education for stroke has been very well done in the past few years. I've had my own patients who've recognized it. A lot of them live by themselves. They're able to get to the phone, to call family, to call 911 to get treatment. There's a lot of risk factors for it. People need to stop smoking and control their blood pressure, get their cholesterol under control, do a little bit more better with eating, exercise. Those are risk factors that we talk about.
So you kind of know if you are at risk for stroke, if you fall into that category.
Absolutely.
Is there also an age factor, or can it really be any age?
It really could be any age, but it's more common as you get older, and with those medical type of risk factors as far as obesity and smoking and diabetes and high blood pressure. Those are things that we counsel our patients about all the time, the signs and symptoms of stroke.
And again, so if it's someone that might be older already, differentiating between confusion that maybe an elderly parent already kind of shows and confusion that would be associated with the stroke, how do we know the difference?
Sometimes you don't. And it's just like when people have a heart attack, those type of symptoms, it's important to call 911 to get to the hospital.
Just take action as soon as you think something might be wrong.
Exactly.
All right. Real quick, let's show you some information. If you have more questions about this very serious issue, you can call that number. And always you can go to our website as well, WKBN.com. Dr. Sevilla, thanks so much for coming in.
Thank you.
We'll be right back after this.